Australians are set to receive a coronavirus vaccine for free as soon as it's approved under a major international deal. The federal government has signed an agreement to secure Oxford University's COVID-19 vaccine if current trials are successful. It'll mean that Australia has access to the formula straight away and will manufacture it here.
The Oxford vaccine is considered a front-runner in the global race, with more than 160 now in development, and the government is in talks with a number of other parties around the world. Let's get more, though, first on the revelations from Victoria's hotel quarantine inquiry. Approximately 99% of cases can now be linked to the state's bungled scheme. Genomic testing has associated more than 3,000 cases from Victoria's second wave to return travellers. 90% or more of the infections have been traced back to the one family of four who quarantined at the Ridges Hotel on Swanston Street.
The first member of the family who fell ill started showing symptoms on May the 9th, and then 2 weeks later, 3 more family members and 3 hotel staff had also contracted the disease. 2 smaller outbreaks have been linked to the Stamford Plaza in Melbourne CBD and to 3 returned travellers who were staying there. Currently, there are 7,274 active cases in Victoria and 351 people have died in the state since the pandemic began.
And in Sydney, the virus has also escaped hotel quarantine with a security guard there testing positive. We'll be joined by the Prime Minister later in the hour, but first let's bring in our reporters. Kathleen Ferguson in Sydney, Steph Ferrier in Melbourne. Jade McMillan is at Parliament House for us. Good morning to all of you, starting with you, Jade. Tell us about this vaccine deal.
Good morning, Michael. Well, there has been a lot of work taking place behind the scenes as the whole world really looks to potential coronavirus vaccines. The Australian government has now announced that it's got an agreement with pharmaceutical company AstraZeneca to secure access to the vaccine that is currently in development at the University of Oxford if it's proven safe and effective. Now, there is a big if still attached to this. The Oxford University vaccine is in a phase 3 trial, and the Prime Minister, Scott Morrison, says that it is one of the most advanced and promising in the world, but there is still more work to be done before it's signed off and made available. If it's successful, this deal will allow Australia to produce the vaccine locally. The federal opposition has questioned this morning whether Australia indeed has the manufacturing capability to do that at this stage. The government insists it does, and that it could roll this vaccine out to all Australians quickly. It's also made a commitment that it will be provided to all Australians for free. There's no price tag on this yet. The government says that a final agreement would need to be signed once the vaccine is proven. There's also today an announcement that the government has signed a $25 million deal with a medical products company to supply equipment like needles and syringes, which of course will be needed if this vaccine is the one that works.
Some positive news to start the day with. Thank you, Jade. Let's go to Sydney. Kathleen's outside the Marriott Hotel at the Circular Quay. Kathleen, good morning. A major investigation now well and truly underway linked to that hotel.
Good morning, Michael. Yes, that's right. So the investigation so far has found that a security guard who was working here in early August contracted the virus while here because genome sequencing has found that the strain of infection that the security guard has matches that of a returned overseas traveller who was staying here in quarantine at the time that the security guard was working. Now, the New South Wales government has interviewed the guard and there has been no indication of breaches as yet, but the government is promising to leave no stone unturned in this investigation as it tries to figure out just how the security guard actually contracted the virus, although the Chief Health Officer here has also said it is too early to speculate. But we know that this security guard also worked at Parramatta Local Court and was also working at Sydney's markets in Flemington earlier this month as well, and public health alerts have been issued for both of those locations. But at this stage, there's no evidence that the security guard has spread coronavirus to anybody else.
Which is good news so far. Let's go to Steph Ferrier in Melbourne. Steph, you're outside the Ridges Hotel on Swanston, and we now know that hotel is where the vast majority of Victoria's current cases can be linked back to.
Yes, Michael, we've been given a clearer picture now of just how this deadly second wave started in Victoria, with genomic detective work proving that 99% of Victoria's current cases can be traced back to the botched hotel quarantine scheme. Dr. Charles Alperin, who's an epidemiologist from the Department of Health, has told an independent inquiry that 90% or more of the current cases can be linked to just one family of four. Now, one of the parents was already showing symptoms when the family arrived back in Australia on May the 9th. After testing positive, the family was moved here to the Ridges Hotel, and 10 days later, a Ridges worker and 2 security guards tested positive, the cluster quickly ballooning to some 17 people. Now, Dr. Alperin has also revealed that 2 smaller outbreaks can be linked back to a man and then a couple who came back to Australia and were quarantined at the nearby Stamford Plaza Hotel. But he says it's impossible to say exactly when and how hotel workers across these 2 hotels became infected.
Steph, Kathleen and Jade, thank you all there. A Perth court has heard one of the 2 women who allegedly breached hotel quarantine laughed at police and hung up on them as they tried to contact her. Police say the women, aged 19 and 22, flew into Perth from Adelaide on Monday night without approval. They were then escorted to hotel quarantine to wait for a return flight, but it's alleged the pair escaped to attend a party in Perth South. They're due to appear in court again tomorrow. Police say they're also seeking a directive to have the women tested for coronavirus.
Medical and tourism officials have welcomed the Tasmanian Premier's decision to keep the state's borders closed until at least December. Premier Peter Gutwein told Parliament yesterday that Tasmania will keep its borders closed to allow sufficient time for the mainland to get COVID-19 under control. It comes days after Queensland Premier Anastasia Palaszczuk suggested her state's borders will also remain closed until Christmas.
A new permit system on the New South Wales-Victorian border has been criticised by grain harvesters. The new border permit is designed to help farmers, contractors and other workers keep businesses afloat. But people entering New South Wales from Victoria will only be allowed to travel 100 kilometres. The New South Wales government says anyone wanting to cover larger distances will be assessed individually.
The World Health Organization has issued another stern warning after images of a festival at a water park in the Chinese city of Wuhan went viral. Thousands of people are seen swimming and packed shoulder to shoulder, not wearing any face masks, and this is the city where coronavirus first emerged. The WHO says people shouldn't be blamed for living their lives, but they're not invincible to the pandemic. The organisation is also warning against vaccine nationalism, urging countries to join a global pact to share potential COVID-19 medicines with developing countries. South Africans are celebrating the end of a long coronavirus booze ban. The country is now permitting sales of alcohol and cigarettes after 5 months with some of the world's toughest lockdown measures. Bars, restaurants, gyms and places of worship are also allowed to open, but to no more than 50 people. The longest and most festive queues were those outside the bottle shops.
And the US may have the world's highest coronavirus numbers, but many Americans sadly are still refusing to wear masks. Now, a YouTuber has come up with a very American solution. This gun fires masks into other people's faces. Right. Alan Pam posted this video showing a pressurised canister that's able to fire a face mask using tiny magnets that fasten it to a person's face. The invention is still undergoing design tweaks, so nasty facial injuries can be
Indeed,
avoided.
more than a tweak, I'm sorry. OK, well, back to the coronavirus situation in Victoria, and we focus a lot on our doctors and nurses, but it's also paramedics who are working incredibly hard at the moment. And to tell us more about what it's like to be on Melbourne's Frontline, we've got Ambulance Victoria paramedic Michael Kinsella joining us. Good morning, Michael. Welcome to breakfast.
Good morning, Lisa. Thank you for having me.
Hey, tell us, what is it like being on the front line now that COVID-19 is such a threat every time you head out?
Yeah, I mean, it has changed the way we do things a lot. every part of our day is different at the moment. We, from the time we get to work, we undergo a health check. Obviously, we're wearing a lot more protective equipment for the patients that we attend. And we're following some really strict decontamination processes after each patient we transport to hospital. So a lot has changed, but we're starting to embed that now. We're really confident in what we're doing, and we've definitely started well.
Hey, Michael, can you explain to people just how much care needs to be taken when you're getting out of the PPE? And we're watching on screen at the moment some of your colleagues getting into the gear, but getting out of it is the tricky moment, isn't it?
It certainly can be, Lisa. So we know that we're at a lot of risk when we're taking the PPE off. So we need to follow some really strict guidelines, as I said. We need to take it slow, and we need to make sure that everything we touch we clean, so that one, we protect ourselves, and two, we clean the ambulance so that when we go out to see the next patient, it's clean and safe for them as well.
What kind of symptoms are you seeing in people when you arrive?
It ranges a lot, so from really mild things such as a sore throat, a runny nose, to people who are really struggling. So they're having difficulty breathing, they need a lot of support from us, and ultimately they can end up in intensive care. So it ranges a lot, and I mean, we don't really know at the time whether they're COVID-19 positive, but we treat them, I suppose, as they are, so that everyone gets the same level of care.
What kind of impact does it have on you?
I mean, it has a great impact. A large impact. I'd be lying to say that we're not tired. We've been going at this for about 6 months now. It is stressful coming to work, but we have faith in our personal protective equipment. We know that if we follow our procedures correctly, we're safe at work.
A lot of chat also about the mental health of you and your colleagues. People so grateful for the work that you've been doing, but are you seeing the impact on your friends and workmates?
I suppose I am, yeah. This is a stressful time for everybody, not just paramedics. I think a lot of my colleagues would agree that in one way we're very lucky. We're very lucky to be able to continue doing what we do, coming out into the workplace and seeing our colleagues. So there are a lot of people at home that are really isolated. They're potentially living at home, not working. So in one way we're lucky, even though it is a little bit stressful at the moment, as you can imagine.
Yeah, I bet. Hey, Michael Kinsella, thanks very much for giving us that sense of what you're all facing each day when you head out.
No problem, Lisa. Have a good day.